Thanks, Kenny. So, as the executive lead whose portfolio includes all things digital, I have the pleasure of seeing up close and personal the sheer innovation and imagination that goes into our use of digital channels, tools and techniques. So with that in mind, I'm sure colleagues will forgive me for taking the opportunity to present to you from within this modern, entirely digital environment. Reflecting on the achievements of the past year, the centrepiece for me was the publication of our trust strategy in November 2020. This was the culmination of several months of hard work by a number of colleagues to translate national policy to local actions, understand the priorities of our partners, and to learn what is important to our staff and service users. And to be able to present this in a way that both articulates the strategic direction of travel for the Trust in a way that is accessible to a wide range of audiences. I want to thank everyone who helped shape our strategy, supported the launch events, and continues to work on the implementation of our objectives. The strategy is about building a shared purpose for all our service users, all our colleagues, and all our partners and stakeholders connected to the Trust. I'd just like to take a few minutes to highlight a few key areas. Our starting point is to recognise that we are a Trust which prides itself on achieving the best possible outcomes for our service users, and this will continue to be our guiding mission as we look forward. We will remain true to our core purpose of providing high quality services to our local population. The Trust's established partnerships with other NHS providers, commissioners, local authorities, police and third sector organisations, together with our strong record in collaborative working, means we are well placed to take an active role in shaping the future design of health and care services across Northern Staffordshire. Central to our local system's continued maturity is the development of a place-based approach, which will support how health and care services are planned, delivered and in some cases transformed. The Trust is playing a prominent role in how these arrangements will be developed across Staffordshire and Stoke-on-Trent and in Northern Staffordshire specifically. As this AGM has already demonstrated, beyond doubt, our staff already deliver excellent care and treatment. They are compassionate and committed to helping service users and their families. Through the implementation of our trust strategy, we will continue to create a culture where they feel encouraged and supported, as well as being empowered to find new and innovative ways to improve care, delivery and support. To help our strategy be as accessible as possible, we've agreed a small number of big themes: quality, people, partnerships and sustainability. You've already heard much in this AGM about our approach to quality and people, and I'd like to just reflect a little bit more on partnerships and sustainability. So within our partnership strategy, we're purposely broadening our horizons beyond our immediate organisational boundaries. We've started to do this through adopting an anchor institution approach. This approach recognises that in order for the Trust to deliver our services, we recruit staff from our local community. We consume goods and services from our local businesses, and our local schools, colleges and universities provide the skills for our workforce of the future. By working together, with an appreciation of this interdependency, we can both improve our services but also enhance the social and economic prosperity of our local community. As a Trust, we've always been clear that as an organisation, we think we can achieve more by working collaboratively with partners than we would do by working simply in isolation. Examples of our partnership engagement include hosting our very first mental health roundtable event with members of the local GP leadership community, a joint meeting of senior management teams between the Trust and Staffordshire Police, being active members of the collaborative network of statutory, voluntary and community groups in Stoke and North Staffordshire, and forging deeper and stronger links with our partners through our activities to support enhanced collaboration across the geography of Staffordshire and Stoke-on-Trent. So turning to sustainability, and in particular environmental sustainability, the NHS has committed to becoming the world's first net zero carbon health service in the world. Over the past 12 months, the Trust has signed up to the NHS pledge to eradicate single-use plastic, has introduced a number of energy efficient measures as part of its estate programme, and the Trust now purchases all its electricity from renewable sources. We are currently developing our green plan to cover the next 3 years, and will set out in detail how we as a trust will respond to the clarion call for action with regard to climate change. I look forward to coming back to report our progress to future AGMs. One final area I would like to highlight is our pioneering success with digital services. The Trust is proud to have been included within the National Digital Aspirant Programme, one of only 24 trusts to be selected, alongside our existing progress as part of the Lorenzo Digital Exemplar Programme. The impact of the COVID-19 pandemic has changed the landscape of delivery across healthcare services, which resulted in an accelerated transition to alternate models of care for both staff and service users. Our clinical services teams have actively embraced digital technology as an enabler to overcome social distancing challenges. The speed and agility of the digital response to the pandemic has raised the expectation of all of us in terms of the importance of digital capability and infrastructure. We have continued to lead the way in using digital development to provide tools and technologies to support new and innovative ways of service delivery. This is evidenced by our CAMS Wellbeing Portal, developed in partnership with local schools and now included as a case study in recently published national guidance, What Good Looks Like. The digital team have demonstrated tremendous resilience and tenacity throughout the year and have continued to go above and beyond to ensure our digital support and delivery continue to reflect our ambitions to establish ourselves as a national leader in delivering sustainable healthcare. This means our technology must be fit for purpose today but future-proofed for tomorrow and achieve value both in use of resources and delivering value environmentally and socially. The Trust has recently embraced a more flexible working environment, enabling remote and agile working through digital collaboration and online interactions, supporting improvements in productivity by limiting the need for physical travel between locations for staff and service users, and has resulted in benefits through reducing the expense and pollution of travel. Building upon existing digital partnerships, the Trust has enhanced and solidified the relationships with partners to deliver cross-organisational systems and improve the availability of service user information to clinical staff. This was essential, ensuring that the Trust was able to play a key role in the development of the initial regional digital response to COVID-19. As a final reflection on the year, it is perhaps fitting to end with the observation that towards the end of the year, I was fortunate enough to be asked to provide executive support to the communications and engagement team. This is a small team that has worked tirelessly to ensure we are able to communicate with all our service users, staff and partners effectively through the continued impact of the pandemic. In particular, we've had several high-profile public-facing events which have been an exceptionally high quality, including the production of this AGM film. It's a privilege to see some of their work up close, and I look forward to continuing to support them in the years ahead. And now I'd like to hand you back to our chair, David Rogers, to invite questions and views from the audience.